Welcome to another edition of At Home with RVC. Today, I'm actually really excited to be joined by a fellow RVC alum. Today, we're joined by Nick Jury, and Nick actually has a very interesting job that we're going to talk a little bit about today that has found him sort of right in the thick of all this COVID stuff. So we're gonna meet Nick, and we're gonna talk a little bit about what he does now and a little bit about his experience when he was a student at Rock Valley. So Nick, how you doing this morning?
I'm doing pretty good, Dave. Thanks for having me and for allowing me to share some of my experiences with some current and prospective RVC students.
Absolutely. It's great to talk to a fellow RVC alum. I won't tell you what year I graduated, not important. But as far as you said you were class of 2003. And I guess I'd kind of like to start there and kind of take me from post RVC through your whole educational journey after that. We'll circle back to your RVC days later, and then kind of leading up to where you are and what you're doing now.
Yeah, so I graduated Rock Valley, like you said, in 2003, and then I transferred, like many of the students do. I went to attend Bradley University. At that time, I was an electrical engineering major. And as happens with many of us, we change our majors. So I ended up changing my major to cell and molecular biology and graduated Bradley University in 2006. I became very interested in science. Obviously, as an engineer, had interest in math, but which is interesting. In high school, I didn't really have that much interest in biology, but I ended up switching into a biological field and absolutely loved everything about it, explaining how living systems work. And I was engaged in research in a lab at Bradley that was looking at animal physiology. And then I was also doing an internship at the United States Department of Agriculture down in Peoria. It's called the Ag Lab. And I was doing some microbiological research. And that kind of really primed me for wanting to get into research and pursue my PhD. Which I did. I left Bradley in 2006 and went to attend the University of Cincinnati in the College of Medicine. I obtained my PhD in neuroscience in 2012. I was actively involved in research looking at postpartum depression, mood disorders, and different drug effects on those different systems throughout my 6 years there. And then following the University of Cincinnati, I went and accepted a postdoctoral position at the National Institutes of Health, specifically at the National Institute for Alcohol Abuse and Alcoholism. And I was there for about 2.5 years, had a very productive time. And there I studied sex differences on the effects of drug alcohol addiction. And subsequently after that, I kind of geared out of the lab. I wanted to go into more of a policy kind of realm, which is why I accepted the postdoc at NIH anyway, because NIH is in Bethesda, which is in close proximity to Washington, D.C., where all the policy makers and lawmakers are. And so I accepted a position at the National Center for Health Research as a senior fellow there. I was there for about 9 months and was involved in active lobbying on major pieces of legislation, one of them called the Cures Act, which actually did a major overhaul of the FDA, NIH, and other agencies related to speeding up drug development. And there were major provisions in that bill that we thought were deleterious to public health, so we were lobbying against them. I was also put in charge of going to FDA advisory committee hearings. And these are hearings where new drugs and devices are being considered for approval. And I would give testimony on why we thought the drug should or should not be approved based on the data and the evidence. And then subsequently after that, I came back to NIH in my current institute, the National Heart, Lung, and Blood Institute. And for about 3.5 years, I was working for the chief science advisor in the office of the director and was very involved with oversight of clinical trials, sharing of clinical data, genomic data, involved in policies with that. And then about a year ago, I moved over to my current office, which is in the communications office, and it's in the legislative affairs office. So in my current job, it's about communicating these complicated scientific findings to the public, to Congress, to lawmakers, also preparing our budget justification to Congress. Congress funds us, gives us money, and being accountable to the taxpayers in Congress about how we're spending the money and what we're doing to address the many different diseases and disorders in our research portfolio.
Wow, that is that's definitely some journey post RVC. And then so your position at NIH, first, can you kind of explain to a layman what NIH is, what it does?
Yeah, so the Department of Health and Human Services is the larger department of the federal government and has several different agencies. So it has the Food and Drug Administration, obviously, which that agency looks at drugs, approves drugs and devices for treatment of diseases. You have the CDC, who monitors and uses surveillance to kind of track different things. And then you have the National Institutes of Health, which has 26 institutes and centers that are all kind of, as you heard me say, National Heart, Lung, and Blood Institute. There's different institutes that have a different mission, but the National Institutes of Health is the largest funder of biomedical research. And a large portion of those dollars go out to grants to scientists and faculty in many of our major universities and colleges. And so that actually is a support mechanism for supporting research in academic institutions, with industry, and in non-for-profit organizations. And so doing the very basic science from animal models all the way up to doing clinical trials in humans of either drugs. And the primary goal is to understand how living systems work and how they impact on health, ultimately human health, and improving that is its goal.
So, throughout this pandemic, I think a lot of people have gotten used to hearing CDC and WHO. Maybe they're not as familiar with NIH. Can you sort of explain where NIH fits in this whole puzzle with this pandemic, and specifically your role that you've played since this pandemic hit?
So yeah, so you mentioned CDC and the World Health Organization. Obviously, the World Health Organization is a world organization that has different members, and that's funded. Some people call it an oversight function. I won't talk a lot about that because that isn't really my remit. But they collect data from. They're basically a convener. They put data together, come up with guidelines. Same thing with CDC. They take the available data and they put out guidelines. NIH isn't in the guideline development business. We try to find the scientific evidence to support that. So many of you probably have seen in the news where there was a study that came out of Montana, which is where one of the NIH labs are, where they looked at how long the virus can hang around in the air, how long it lasts on surfaces. So research like that, that's really pivotal and important for informing policy and decision makers. And my role specifically, so, the virus affects the heart, the lung, and the blood systems from what we're understanding. And it's got a very complicated and evolving presentation. We continue to see different cases and how the virus affects different people. But my role specifically is to report back to Congress everything we're doing. So the coronavirus task force, it sits way up here at the White House level, and they have to get all the information. So, the government is this large layer, and NIH is here, and the White House is up here. But one of my primary responsibilities is to take all of the things that we're funding, and Congress did give us more money to address in our institute and NIH in general to address, obviously, the pandemic. So anything that gets funded and that's noteworthy, like a clinical trial or if there's some kind of scientific advance, my job is to convert that into more layman's term language that a bureaucrat or that a policymaker would be able to understand. Even though the task force has doctors and scientists on its membership, every week we put together a whole package of what needs to be sent up, and that goes up through all the layers and then eventually ends up at the White House, which is kind of cool, to inform decisions that are hopefully going to be made by the task force. They need to have all the available data for them, and that's kind of currently what's been happening with the COVID. In general, my general job is, we put out press releases on different pieces of research we're funding. Like I mentioned, our budget justification. So every year we do what's called the CJ, the Congressional Budget Justification. And in there, there's a lot of rich information about scientific advances that our institute has funded. So last year we included something, about a Nobel Prize winner who we had supported. So obviously we're going to put the most important and the most impactful research that we have supported when we're talking to Congress. And Congress also can come back and ask us different things like, what are you doing with this disease? What are you doing with this? And then we always respond. And then another component is talking to the stakeholder groups, so the American Heart Association, American Lung Association, and working with them as partners to try to understand these different diseases and just trying to understand what they're bringing the patient perspective as well. So it's a really cool job, just being able to take all this science and converting it into understandable information for the public, for patients, for Congress, just anyone in general.
That's, that's obviously an interesting point about trying to put it into terms that the public will understand. And there's been a lot of misinformation and things like that throughout this pandemic. I guess what are some of the key things you would want people to know, about the virus, about the strides we've made, and maybe some of the challenges that you think are left before we're going to be able to lick this thing?
Yeah. So, and like I said before, these are obviously my opinions. I'm not a physician.
Sure.
I have a PhD in neuroscience, and obviously I've been reading every day the scientific literature. But I think the most important thing to take from this is to listen to, Dr. Fauci is the head of the National Institute for Allergy and Infectious Diseases, and he's been in kind of the spokesperson for a while on these different things, for Zika and Ebola. And, the biggest thing I think for the American public is just to listen to the CDC, listen, there's coronavirus.gov, which is the main source of all the vetted information and the information that's been carefully looked through. Now, obviously, if you're a little bit more scientifically savvy, there is a PubMed specific search term through the National Library of Medicine, which, by the way, is part of the National Institutes of Health. They've curated all the scientific articles that are being published and that have been peer reviewed. But obviously, even if something is peer reviewed, we don't want, someone reading a paper and just saying, and then trying to diagnose themselves. But the biggest thing I think is just trying to remain calm and know that, we're working on it. And as Dr. Collins, who's the head of the National Institutes of Health, has said, we're moving very rapidly towards phase 3, which is one of the final phases, where we're looking to make sure the vaccines that are being developed are safe and effective against the virus, and hopefully that they would be able to provide protection. And still one of the underlying questions is if you have antibodies, do you have immunity? And obviously that's something we still need to understand and grasp, because as you know, with the flu, we provide vaccines, but sometimes the flu comes back in different forms. And these are still unanswered questions. And I know that makes them look very uneasy, and that isn't always the easiest thing to say, but we as scientists need to stick to the science and be clear. But with all that being said, I'm very positive. I'm very comforted by the efforts that are being done with this. Literally everything is being thrown at this, industry, private industry, the government, academia, everyone is really working together, and there are a lot of efforts, and even across the world, just to try to combat this thing. So I would just tell people, to try to remain positive, follow the guidelines. And I know it really is not, it's really inconvenient, and it's really shut our lives down, but there are a lot of dedicated people who are doing a lot of things. Even though you don't hear from them or see them every day, there are a lot of people that are working on this.
Absolutely. And, we appreciate the role you're playing. Obviously, we're concerned as a college about whether we're going to be able to get students back on campus, like colleges all across the country. Let's go back in time to your time at RVC. What was it like? What was your overall experience like at the college?
So back in 2000, when I came, and we actually had 9/11 happen in between, when I was there. And so that was a major impact on my days. And those are the things that kind of weigh the most on me, remembering us as a country going through that. But overall, as a student, it was a really great experience for me. And because I kind of didn't really know what I wanted to do. I know I wanted to pursue some kind of scientific path, and I took every math course available there. I almost got a math minor because I enjoyed math. I enjoyed science. I enjoyed the humanities and the liberal arts education I got. And I enjoyed the personal attention of the professors. And I won't mention names of some of my favorites because I would leave them out, but there's just the attention and the detail of the faculty at RVC, the personal attention you get, and the small class sizes, and just the community that I felt was there was very enriching. And as someone who was still working at the time too, I think I was working part-time as well. And there's many people I know that work and go to Rock Valley. It's a very good learning environment.
In what ways would you say it laid a foundation for you as you went on and obviously did a lot of things in education-wise and career-wise? Have you ever looked back and said, oh, my experience at RVC really kind of laid a good foundation for that, or helped me along the way?
Yeah, it kind of did. So reflecting back on those days and just the personal attention I got. I was also very involved on campus. I was involved in Phi Theta Kappa, which is the honor society. Also involved in Circle K, which is the college group of the Kiwanis. The faculty who were the advisors in those clubs, who just took personal time, obviously, out of their lives to enrich ours and be a part of that, just really solidified my leadership skills as I went through school. And, it was a good transition point. A lot of people go from high school immediately to university. And I felt so much better prepared when I went to Bradley, even though the first year was really kind of a struggle for me because I was figuring out I didn't want that major, and that's why it was a struggle. But once I switched into that correct major and was really going, the Rock Valley really prepared me for the rigor that was going to be needed at a really, powerful research university. And what made me well poised to get those additional scholarships as well. I got so much scholarship money and was really, really sought after by a lot of the schools that I applied to. I had ended up on the wait list at Stanford, by the way. I remember that now. Cheryl Krakow at the time, who was the VP of the college and the top academic officer at the time, wrote me a personal recommendation letter. She was also involved with Phi Theta Kappa and kind of a bit of a mentor. And just to get on that, a school like that, and I'm actually happy I didn't go there because I switched my major, so I can only imagine how much, my loans would be. But the skills, the learning skills, the leadership skills, the training, the rigor, and just financially, it was the best decision for me because, having gone through all those years of school, even in grad school, just keeping my loan amounts down, I really appreciated that.
Well, you've done a pretty good job already of sort of selling the college to a prospective student. But if there was a student sitting across from me right now and was kind of wavering, kind of thinking about maybe Rock Valley, maybe somewhere else, what would you say to them to convince them to come to RVC?
And I'd tell them, the dollar, the value, the return of value. And I don't know what the cost of per credit hour is now, but I imagine it's probably only a third of what you would pay at a major other university. And I would say it's not going to hamper you. I got on the wait list at Stanford, and went to Bradley. And Bradley is a really good school. And I will still push that school as well, because it was a great experience for me. But Rock Valley, it just, for the value you get, the personal attention, and the faculty are just so great. At least, the ones that I had when I was there. And I still remember all their names in my head and the experiences I had. And it just really was a really great time for me. I remember it being a really good time.
Great. Yeah, likewise. I have the same feelings and same experience when I was there, and I still talk about my professors from back in the day. So, Nick, we really appreciate that you took some time. I'm sure you're very busy these days, and thanks for reliving your RVC days a little bit and telling us about what you do. And it's great work that you're doing, and appreciate it. And stay safe.
Yeah, thanks, Dave. Thanks for having me on, and you all stay safe as well. And and I'll be interested to see, you know, how the college continues to grow and expand.
Okay, thank you. Take care.